I used to take 4 Tylenol in the morning. Then I'd switch to a couple ibuprofen. And then 4 hours later, if not 3, I'd be back to the Tylenol again, trying to control this pain. And now I don't take anything. Absolutely no medication. My name is Dee, and I'm from Dyersville. I came to InMotion Pain Solutions because my knee was really bothering me. The pain in my knee was so bad, it hurt a lot, it ached all the time. Mostly when I was trying to sleep at night. I just couldn't get comfortable. I just felt older. I felt older and just like, oh geez, I'm a grandma anyway, but you're a grandma for sure. I got to wait for grandma and make all these exceptions for grandma, and I didn't really care for that. It just wasn't really me, and then, I'd sit around a lot. I'm tired of sitting around, but you really couldn't do much, so you didn't have much, choice. The doctors told me that I had not a bad enough knee to have it replaced, although I thought it was very painful, but they said I would need a new knee in probably 1 to 5 years. They gave me 3 shots in my knee. It didn't really seem to help, so I was looking for something else that might help. When I came in to see Dr. Ben for the free consultation, I was pretty leery. I don't trust a lot of people and a lot of gimmicks and stuff nowadays. There's always some scammer out there. He told me that there was scar tissue. The other doctor told me there was arthritis, but he didn't say anything about scar tissue. But Dr. Ben said there were both, and he thought he had a treatment plan that would work. And I remember asking him, what is your success rate? And he said, for knees, 80%, a little more than 80%. And I thought, well, that's a pretty good percentage. Let's go with that. Laser therapy is something I'd never heard of before, but I think in conjunction with everything else Dr. Ben does, it works. Oh, if I had to characterize the pain between 1 and 10, maybe I could say it was an 8, just because I don't know how much worse it was going to get before they were going to give me a new knee. Now it's probably a 2. They're not my 30-year-old knees. They were wonderful. But that's what people take for granted. Your 30-year-old knees are going to last forever. Well, they don't. I can walk now. It's given me my way of life back. I remember thinking, if I had all the money in the world, what do I want more than anything? And I want to be able to walk. It's a simple thing, but it's something everybody takes for granted. I had a trip planned with my daughter. I talked to my daughter, and she's like, well, Mom, you going to be able to do this? And it's like, yep, I'm coming. We're going to do this no matter what. We went to England and then Scotland. And we did lots of walking and lots of steps. And I was so proud of myself because I could do it. If I would not have come down here, I couldn't have done that trip. There's just no way. I was surprised that it worked, number one, because it's like, I don't know. This sounds too good to be true. I thought that I would get a little bit of relief maybe. But I was surprised that I got as much relief as I did. They're so friendly. The whole staff is so friendly. And it was an easy place to come. It was easy to find just off Highway 100. Just lickety-split, I could be here and home. I just thought it was just pretty perfect. I want to take all the time I can to still feel young even though I'm not. Then I can still do what I want to do. And he really helped me to be able to do that. I would recommend Dr. Ben to anybody who has trouble with their knees. Give it a try.